Aloha. Thank you for joining us. My name is Josh Green. I'm a senator from the Big Island. Today we're having a special taping and session on behalf of the Big Island on a big issue, healthcare. The healthcare crisis that's come to us from the mainland that we all experience every day is the focus of a segment, actually 4 segments that my colleagues and I have decided to discuss with you. Today we have 3 experts and then my colleague to my left, Senator Takamine, to discuss what we really believe we can do on the healthcare crisis from the perspective of our community health centers. This is something that's very dear to my heart. I worked in the health centers as a doctor here in Hawaii from 2000 to 2004, so firsthand I saw how important they are to us. First, I'd like to introduce a few of our guests today. We have Paul Strauss from the Bay Clinic, the Executive Director, Susan Hunt, Hamakua Health Center Executive Director, and then my friend Richard Taaffe, who is the Executive Director of West Hawaii, my hometown. And then again to my left, Senator Dwight Takamine, Hilo, Hamakua, and Waimea. Today we want to give you just an informal view of what health centers do. So we'll dive right in, and I'd like to ask Mr. Strauss, Paul, could you tell us a little bit, give us an overview of what health centers are all about?
Certainly, I'd be pleased to. First of all, thank you very much for giving us the opportunity to share our work with you. Community health centers are federally sponsored health centers that are especially designed to serve the needs of the underserved. By that, people on public assistance programs, uninsured individuals in medically underserved areas. They are nonprofit entities and they are community-based and community-governed. Our boards consist of a majority of patients of our centers, which makes them very special in assessing the needs of the particular communities that they serve. In Hawaii, we've got, at this point, 14 community health center organizations throughout the state with over 40 operating sites. And as we look at the Big Island in particular, we've got a team of 3 community health centers, West Hawaii Community Health Center, Hamakua Health Center, and Bay Clinic Family Health Centers.
Excellent.
You know, on that note, because many of the communities on the Big Island are rural communities, and the community health centers make such a huge difference there. Would you be able, Susan, to maybe share with us some of the insights in terms of how you meet and respond to the healthcare needs of, say, the Hamakua and Kohala area?
Sure. First of all, community health centers get placed in very small, rural, needy communities based on whether or not they've been designated as a medically underserved area, a medically underserved population, or a health professional shortage area. And so on the Big Island, the entire island is designated as a health professional shortage area for dental services and mental health. And then we're kind of divided with regards to the medical component. I think Bay Clinic probably has the highest score in terms of not having enough physicians per capita. Hamakua, actually, we did a great job of recruiting physicians, and our HPSA score was reduced. So we have a very low, or very high score, low score, I guess, at this point, which means that it makes it a little bit more difficult to work with National Health Service Corps and to get additional funding when you're not designated at a level that really draws attention to your area. And Richard, I don't know at this point where West Hawaii is. I know that South Kohala has a pretty intense need when you look at all of the people that come in from various areas around the United States as snowbirds and also part-time residents here on the Big Island. What we do in those communities basically is provide access to care where they otherwise wouldn't have access. We place physicians in very isolated areas. We integrate that with mental health and dental services and provide a way for people that normally wouldn't have access to receive those services.
Let me ask you to clarify. So I hear you say health profession shortage areas, and I know from experience that means we are short on having enough health professionals.
Right.
That's the layman's description.
Right.
Tell us a little bit more, if you would, all 3 of you. What do you think about Big Island as far as enough doctors, too few doctors, specialists, and so on? And also tell us a little bit about what your average patients are like and what kind of needs they have.
I'll take that one. And being the newest health center, being only 4 years old, recruiting has been a challenge and continues being a challenge. So we are recruiting from within the community and outside the community. We've been having to use locums or temporary docs because we haven't been able to find permanent ones. I think in Kona, it's been a particularly challenging time with physicians because of those who either have left, and we hear that, and then specialists as well as general practice and family physicians. It also, a lot of physicians who are practicing are no longer participating in the health insurance plans. So it creates an access problem, and that's one of the things, back to who we are and what we do, is to make sure that we can provide access to care for those who don't typically have access. So in terms of recruiting, we're out there constantly. We have loan repayment, and so we can try to recruit physicians who are interested in maybe just out of school and they want their loans, because they can run up to $100,000 and $200,000 in loans, and if they work with us, they can get some loan repayments.
Yeah. In fact, I'll thank Paul, because his organization, they paid, well, the federal government, but through Paul, I paid back my medical school loans, which were, I think, $145,000, and I would have never been able to pursue other interests like this if I hadn't had a good situation working in a shortage area, and my debt went away. Right. So I think that's what you're referring to.
Absolutely, and there are a lot of physicians out there, and nurse practitioners, and PAs, physician assistants, and even nurses and behavioral health people who are looking for that and want to serve in underserved areas. In terms of patient population, we see a wide range of people, from those who are uninsured to those who are on public assistance, like Paul mentioned, Medicaid, Medicare, those who are on private insurance, HMSA, UHA, and those types of insurances. But they also are a diverse population in terms of Susan mentioned the snowbirds. In Kona, we have a lot of those, but we have a lot of local folks, Native Hawaiian folks who come in. We have the Marshallese population. Actually, 10% of our patients are Hispanic and Spanish-speaking. So one of the things about community health centers is we try to understand the needs of the community and then address those needs. And part of those needs is looking at the access issues for particular populations. And so it may be a language, and so we need to be linguistically and culturally appropriate. We need to be able to have people who can communicate, because if someone comes in and has a difficult time expressing what their needs are, and how can we really take care of them? And we're really about providing high quality care. And so I think we have a diverse population, and I think that's especially.
Yeah, I'd like to add to that. As we look at the Big Island community, which in my mind is quite unique to urban parts of the state, we have one of the highest population growth areas, one of the highest poverty rates, and clearly poor health is associated with poverty. 70 to 80% of our clients that are coming into our centers are near or just barely above federal poverty levels.